So students, yet another session is over, and we have rank one, Ames rank one. I remember he messaging me, and his wife also is Marrow student. So he's again from Kerala. So multiple reasons are there to introduce him. This is Dr. Sreehari. Sreehari, can you introduce yourself? From where are you from? Where did you do your MBBS, MD, and how was you preparing everything? Can you just introduce yourself first?
Thank you very much, sir. I am Sreehari. I am from Kerala. I started my MBBS in 2014 from Maulana Azad Medical College, Delhi. There I had a fortune of having guidance and interaction from so many professors who made me choose medicine. That was the first thing. They shaped my career. And further, MD medicine I had done from AIMS Raipur, and currently I am working in JIPMER. I did my senior residency in medicine for 1 year, and then I did my non-academic senior residency in neurology department JIPMER for 4 months. That helped me prepare for neurology in a focused way.
So you were as non-academic SR in neurology this year, last year. Oh, okay, wonderful. Yeah, many of our students are there. I think like Payani, Sai, many are there.
Yes, sir. Yes, sir.
Yeah.
All of them have helped me throughout. I would like to start by thanking my parents and my wife, Dr. Amritavarshini, my in-laws. All of them were so much supportive, helped me prepare during this phase, and along with that, all my friends, teachers and juniors, right from UG to PG to JIPMER. Then, sir, lot of credit. I mean, I think the whole of credit in how I could understand neurology and the way I could approach the exam goes to you. Not only approaching the exam, sir. You in the video, I felt like it was not just an exam based. You focused on building the concept. So even in MD medicine, it helped me a lot, and even in my practice as a general physician also, the way you have taught has helped a lot, sir. I'm grateful for you. For without you, this rank wouldn't have been possible at all.
Mhm. Thank you so much. Actually, the neurology is such a subject which you cannot mug up. You
Yes,
have to love the subject and learn from the basics. And if you love the subject, this is, I don't know, because as a neurologist, I will feel the same. I don't know, but for me, from even during the MBBS or MD time, I always was fascinated with neurology, and I felt neurology is one subject is purely clinical, and you need to have a lot of understanding. But if you understand it, is very beautiful subject.
yes,
Yeah.
sir.
So what about your family? Like, who you are from?
Yes, sir. I'm from Thrissur, Kerala. My father was in defense accounts. He's retired as a controller in defense accounts. And my mother was she supported me, and for that she's is a housewife. So she stayed back full time to support me. So without my parents' support, I couldn't even imagine cracking MBBS for the first thing. That all of these are afterwards. Even cracking an MBBS would have been difficult without them to back me up. I remember days when I thought like I won't be able to crack MBBS entrance exam. So looking back, they were with me all throughout. And then currently I'm in Pondicherry. I work in JIPMER, and I'm with my wife Amrita Varshini, my in-laws and uncle. So we all live together as a joint family. So all throughout this journey, they were there to support me. And my relatives, friends, juniors in all colleges, everywhere I have received support. And I feel like it's all a journey, and all of this matters, and it's not just that one last 3 month preparation which defines this rank.
Yeah, and like the most important thing, actually, I always felt not about the DM or super specialty. Uh, for a doctor to be in India, actually, you need lot of support system after MBBS, because by the time you finish MBBS, you will be like your correspondent person who has done an engineering might be joining his job. By the time you finish your MD, they will start building their own business or home. By the time you finish DM, their kids will start studying for the school. By the time you start establish as a practitioner, your plus two mates kid will be might be writing the plus two exam. So that is a huge journey. Where there you need a lot of support, like in general for any doctor. That is one difficult scenario in India. Actually, in fact, that is a fact. So you were lucky to have a proper support from the family also. So And your wife was also did last year, no? Like she was
Yes,
also.
Dr. Amrita Varshini, she had cracked the exam. She had ranked two. She again, you are the factor between both our ranks. You are a common factor.
Yeah, I remember her. She messaged me and took the interviews and now like how was your preparation basically, and how was it started? Like whether it was during your MD time or then after MD, and you worked in neurology also as SR, so you might have much more knowledge and attachment with the neurology than others. So how was it? How was your preparation? How was it towards neurology? Why you want to go to SRship also in neurology?
Sir, I felt like I always want to remain close to general medicine. So in my preparation, all throughout, I kept reading all the general medicine subjects like infectious disease or critical care or the other subjects, and I felt like to get a rank, your base in general medicine has to be strong, and you have to keep revisiting the subject again and again because 20 questions matter a lot. Along with that, then when I wanted to dive into neurology, I felt like having working in a department will give first-hand experience. And when again preparing for the subject, so most of the cases I had seen either I had worked up or my colleagues were working up, and I had learned from the professors. They had told in OPD all of I even though it was a hectic OPD, I used to take time and go and discuss most of the cases with my professors, even though it would go on late till evening the OPD. So all of these things helped me when I was preparing because many of the things I had seen upfront, the happening in I had seen EEGs being reported by our epilepsy consultant. Same time MRIs they would be seeing and discussing what are the findings. So these things really helped me. I felt like that way I had an advantage being in the department and seeing real life cases.
Yeah, and I want to ask you one thing, like because you were like I had told this thing in previous interview also. Like I was also like I wrote the first NEET SS. When I was writing the first NEET SS, I remember like it was after my theory exam, just before my practical exam. So I did my MD in Mysore Medical College. So my exam center was in was in Bangalore. So it was like 2 or 3 days prior to my practical exam. So we all went like a trip. Like we all PGs were studying together. We traveled together. We went to the taken room together and sit back and studied for the practical exam actually, because our plan was to just to know how was this exam, what is this shit, because this was the first time it is happening, so we don't know what is it. So my plan was to stick on to medicine. So I joined one Pushpagiri Medical College, and I was working as a consultant in medicine, assistant, I mean SR in medicine. So suddenly this rank came because I always had to have more clinical medicine inclination. I was confused between cardiology and neurology because these are two entities which I thought always have clinical background. Then I joined cardiology for first counseling in Kottayam. Then I worked in cardiology, and then I realized that cardiology, which I had seen in my MD, is different from what cardiology it is practicing. The practicing cardiology is more of the surgical intervention based and less clinical thing. Then I left the course and I joined neurology. So then I realized that neurology is one subject which is very much close to clinical. So you might have been practicing in for last four months in neurology department, Japan, one of the premier institute again. So I think you might have felt the same. Like neurology is one subject which is very much clinical inclination, and
Yes.
so somebody who like medicine will always like neurology, isn't it?
Yes, sir, true. There is so much overlap with medicine that even when there was a case of dystonia, it was due to Wilson disease. My consultant had asked me to present Wilson disease from a general medicine angle. Me being from a general medicine background after SRship, and since I was still working as a non-academic SR, they were more curious about the general medicine angle of Wilson. So there is so much overlap of neurology, and at the same time, even the methodology of neurology is core clinical bedside medicine. We start with history and examination and investigations. Before even looking at the investigation, history and exam, there is so much. My consultants I saw, they spend so much time, up to an hour, to analyze the history and examination before even looking at the investigations.
Yeah, always neurology. That is good thing, and that is a bad thing when you come back to practice in private sector. Private sector, you have to see number of patients you're seeing will much higher. So there, what you have to have is like you have to catch red flags. because you don't have much time. You can stay with the patient for maximum 5 or 10 minutes. You catch some red flags, track behind that. That is actually in fact good also. You'll make it more
I believe
faster.
even that is a skill. Even that's a skill. Like we can go on with patient for 1 hour, but even catching the important things and thinking about the patient as soon as we see the patient walk itself and skill, and that also comes from expertise.
Yeah. So how was your preparation from Marrow, and how did it help you, especially for need preparation? And you have exposure to neurology also. So how was it there, and how was it for the preparation as well as for the SS?
Sir, the preparation for SS, I would honestly say it was not this 6 month. It started from my MD days itself, because honestly I had subscription to the Marrow app from my MD days. So MD days, sometimes if I'm tired, like if I worked so much, I'm tired, I won't have the energy to open the book and read. That's very difficult. So passive learning through videos, even if I wouldn't make notes or anything, but definitely passive learning through the specialty videos, especially neurology, nephrology, and cardiology. Or these videos, I used to go through specialty videos when, especially if I see such a patient. So then it wasn't targeted at that time. I didn't make notes or anything. But of course, again, seeing the video again when I was preparing for the entrance, that helped a lot, because now I saw a different point of view and I was retaining it better. Then, when I was reading for this exam, along with the videos, what I focused on were the grand tests. Grand tests are so well crafted in Marrow, because they show a real time rank, and so many aspirants will be giving the Marrow grand test. So I will get rank among so many thousands, like 2,000, 3,000 people would have given that test. So it's really a real life uh, parameter to assess our performance. And that way I started with grant tests, and based on the grant test, I got an analysis of what areas I'm weak on. So I started revising those areas first, so that more of my energy will be put into my weak areas. And then slowly, when was giving further grant test, I realized that those areas started becoming relatively stronger. So whichever were the topics in which the answers were going wrong, I was going towards the QBank and video that way.
So you were utilizing all the available resource like QBanks. You're using this, and actually, I don't know whether you have gone through, because we have started a new thing also. Like we had started something like residential program. Actually, I think that I was enjoying taking those areas because, like my way of approaching teaching on neurology is always clinical. So that actually I had put maximum clinical things. So I actually was enjoying taking those videos. I don't know how was the output and all, but I enjoyed it. So have you
I
watched
used
those?
that. Yes, sir. I honestly use that because interview was a phase in which you have to go back to clinical medicine again. Like the 80 questions of MCQ might be coming from neuroembryology and fact-based things. But when we start with interview again, we have to be core clinical. We have to start from history examination, the pace of how the disease is evolving, and localization exercise. Like first you have to localize to the neurological axis, and only then tell about the etiology. So that practice I enjoyed so much in your videos. I had seen those videos also, and I use those videos to frame answers in interview.
Yeah, actually, for the stage two, like we have conducted one mock, like it's not a mock interview, somewhat like that. So, so how was that, and whether it helped you?
It helped.
And what is the take to you want to tell about students, because many students are very much desperate about the interview. So what do you want to tell to them?
Your session had also helped, sir. I would honestly tell the aspirants who all are preparing for interview that first thing after the test is to not look back at the theory questions and think that this question could have been right, and analyze whether the other people in all these recall discussions, analyze how the other people have done. Are they commenting in the right answer or wrong answer? Not to think about these things. Keep the 80 marks behind and think of the interview as 20 more marks to score, because that every mark would uh, make a difference in whether what institute you get. So and then once you decide to start preparing, none of these interview sections, like it was a 3 hour long session, I remember that you took, but that was so valuable. It had so many pearls. and the way you were describing how to approach a case and how the examiner wants us to say rather than jumping to the diagnosis, that is more important, I feel. Even they may give an imaging which we may not know the diagnosis, but more important to score those 10 marks, mostly it will be 2 marks, 10 marks and 10 marks, two questions, sorry, two questions of 10 marks each. So how they will assess us is not just based on the exact diagnosis that we tell. It's based on the methodology that we are identifying the MRI sequence and then telling that the what are the possible differentials, and based on that, what do you assume it is. Honestly, I'll tell that when I had a question on pachymeningitis, so immediately I could not describe what that exact diagnosis is that they wanted. But when I worked through it, that I can see a T1 post-contrast sequence and the meninges seem to be thickened. And then because I told that first question they framed is, why do you feel it is pachymeningitis and not leptomeningitis? So again, in that approach, I could score points by telling that why I feel it's a pachymeningitis. So if we practice for interview, especially through your discussions of interview, that practice will help us score, because it's not just like an MCQ exam where you can just tell that this is a name sign like they had actually shown me Eiffel Tower sign in the sagittal section of pachymeningitis. But immediately, if we would have been in the MCQ mode, I would say it's a spontaneous intracranial hypotension. But it was not that. It was to describe what it is and look at the patient's history and examination and correlate. So you have to spend time when preparing for interview clinically by correlating the MRI images and by practicing neurological localization repeatedly so that we are fluent in that.
Yeah, basically, stage two, many students used to be get interview session. They used to ask how to do it. Like, see, for others who are listening, one thing you have to accept that interview session is something you cannot prepare well. Whatever you know, that only you are going to tell. So you have to frame what you are going to tell properly. And the most mistake what everyone will going to do is, when you are preparing for MCQ for 1 year, 2 year and all, whenever you see something, just like you have a tendency to go and tell directly the answers, or go and tell directly one or two signs. Don't open those words come to your mind initially, because your mind is tuned for this MCQ. So you will go and tell like something like Eiffel Tower or something, you tell, the exam will get irritated. They want is what a systematic flow. So even if they, like you were telling, like even if you don't know, you just explain things, they will help you. Remaining things, they will help you.
They were helping me out definitely. They weren't there to intimidate me. They will help you out once you start with the basics, and once you are approaching the case, they themselves will help.
Yeah, and one more thing about interview session is, nobody can prepare well for an interview. Interview is always that point of time how you manage things. Nothing more than that. So it has a luck factor. So if suppose you are going to get something, the most difficult question you don't know properly, another person is getting an area. Suppose I have done a thesis on my during my MDM time. If suppose I had done a thesis on pachymeningitis, and the question of pachymeningitis come in front of me, I'll be scoring 10 out of 10. So that luck factor always there. That is that you have to accept and go for an interview. An interview is one exam. Like I had been seeing students getting so much tense for that. But actually, if you are done the MCQ part, interview is one exam, you should go without any stress. Because interview you cannot predict. It is not in your hands. You just go, deliver whatever you do and come back. That's what I
I
thought.
think one suggestion is a neuroradiology they can invest time on after the main
Yeah.
exam. Because both my questions were from neuroradiology.
Yeah, they keep on asking, like I think like I had collected questions previously also from students, and then like it was a learning curve for me also. Like when I remember, like when I was doing the first preparation for SS interview, I told the students that I don't know what they're going to ask. They can ask anything under the sun. You prepare whatever you want. That was actually my take on that time. Then I realized after getting the question, so it is going to be we can see the evolution. Initially, it was like very random question. Then it became more framework based. Then now it is very fine-tuned thing, at least for neurology. They have particular pattern of giving the questions, then suggestions like that. They'll keep on asking. So that's actually now a really good way of doing interview. That is what is happening. But that is the beauty of interview. That has to be like that.
And honestly, I feel like they will expect answers at a general medicine level only. Most of the
Yeah,
questions
true.
they are asking is stroke and epilepsy, which are managed at general medicine. They are not asking neuroembryology, at least. Those things are not asked. So
Yeah,
they are expecting from a general medicine level.
Yeah, they just want to know that how will you be performing during the practicing there as a casualty, whether you will be able to handle the cases first. Second, what is, suppose you are able to do in a proper pathway, that means that your interest is genuine towards neurology. That is what they want to know. And among the videos in Marrow, like you have a lot of things, like you have specialty videos, you have medicine videos, you have some MCQ sessions, you have recall sessions. Then now we have added the resident corner. So resident corner, I will tell all the students who are like next NEET INASS, if they're preparing for the stage 2 interview, there are some approaches we are given that will definitely help you, because that is the pattern they used to ask. They ask about approach, not about knowing some fine signs, fine things. Those they are not expecting. They are expecting you to approach things properly. That is what normally a theory viva in your practical exam you will, the examiner will expect. So how among the all videos, which all areas will you want to tell that this is good, this is bad, this need improvement? Anything is there you can tell.
Honestly, about I can't think what areas need improvement, sir, but I can honestly tell the aspirants which areas to focus on, like stroke and epilepsy. Like you cannot go to the exam without revising these topics. Especially epileptic encephalopathy are in two parts. The videos, it might seem a bit overwhelming at first. If anyone is from general medicine background is watching those videos, it might seem overwhelming to them because there's lot of pediatrics to it, and most of the disorders will be in infancy age or in early childhood age. But these topics you cannot leave and go. So I feel like stroke and epilepsy has to be covered through and through. At the same time, especially the section along with the neuro infections, all the miscellaneous topics like autoimmune encephalitis, neurocutaneous syndrome, that's also another high yield session we tend to skip because they are all these are a miscellaneous bag of topics and they are not in an order. So due to some discomfort, we may skip it because all the others are orderly placed, like movement disorders in one entire group, whereas stroke is in one entire group. But this miscellaneous group of autoimmune encephalitis, neurocutaneous syndrome, and neuroinfection, this is a very high yield area that we cannot skip and go.
And I had put it as MCQ discussions on most of these areas just because if I take it as theory, it will be so boring. Because these are a vast areas, it will be very difficult. It will be boring. Otherwise, I thought that might be interesting if you put it as MCQ.
True, sir. They are fact based, sir. The questions are fact based. So if autoimmune encephalitis is about the antibody, so in at the end of the day, it's fact based.
Yeah, correct. So what is your plan now? Like why again? One more question. The last, like, why again? I'm asking the same thing. Why neurology? Like, because now your wife is also in neurology. You're also right now doing in neurology. You want to pursue neurology. So why? What is the reason for entire family inclination towards neurology?
So honestly, again, for both me and Amrita, it was like we want to stay back in medicine. So way to stay back in medicine is to take the what we can call the queen of medicine, neurology, because all the methods of general medicine is applied in neurology most. So that is I feel the biggest subject in among the biggest. Maybe infectious disease might be something which is at par because of so many infections, but one of the biggest subjects in medicine which requires so much reading is neurology, and it is so much rewarding because neurological disorders are so common. And I feel like when as a medicine resident, when dystonia and all used to come, I couldn't think of what to I couldn't do justice for that patient. So reading all these disorders, because which are actually very common, it was very rewarding for me.
Yeah, like as a like I'm practicing in a medical college in private sector only, but it is a very busy medical college. So from my practice, like I'm now practicing since last 4 years in this college, and 1 year I did in SRship in Trivandrum, all the medical college. So it's a very busy specialty. If anybody want to ask about neurology, there are certain points, like there are certain things which you think it is wrong actually. When you think neurology, there is no treatment. Actually, that is totally wrong. Like you are giving treatment for diabetes, that is lifelong. Like you can relieve a lot of things. Like neurology, there are a lot of struggles in neurology. Like neurology, one, it is very vast subject. Second, neurology is one subject, except you take out stroke or maybe some mass lesion. Remaining thing, you need to have a diagnosis from using your brain, not by any investigation. Investigation will fool you more. you have to think about the case history, examination, your findings, your serial arrangement in a chronological order of the disease. All those things will help you to arrive at the diagnosis. At the same time, this give you lot of kick when you diagnose something which is difficult to diagnose clinically. But the same time, there's another problem. Another problem is the patient goes to another neurologist, his brain may work in another way. He may end up in some other diagnosis that can occur. So that, if you that part is said, but that is the best part of neurology. Because I promise you that if you're practicing as a neurologist, at the end of the day, if you're not thinking about monetary basis, you're thinking more about the satisfaction you get in clinically treating a patient. Neurology is the best branch, because neurology is something which gives you that much kick in diagnosing cases, that much kick in treating cases. You will see in front of you how the patient suffering is improved with your treatment, and that is something which will give a lot of kick to you, unlike you are going to do an intervention and all. I personally is not a big fan of intervention, but there are some people who are inclined to intervention. They can go into interventional neurology, but general neurology is the queen or king or whatever it is. A general neurology is my point of view. So what is your favorite area in neurology, basically?
I am unable to decide on a favorite area, but yeah, sir, because all of these areas which diagnostic neurology, I would conclude reaching the diagnosis is my favorite part in neurology. And I
Basically
would add,
one.
yes, sir. And I would like to add to the part that when someone also says to me that neurology is more about degenerative diseases for which we don't have option to offer. Even I have seen cases of muscle dystrophies which have been misdiagnosed as inflammatory myopathy, and they have been given steroids. So they will be living with the side effects of steroids so much. So even giving them a diagnosis of dystrophy, it will, it's like saving them from side effects. If inadequate knowledge of neurology will make someone diagnose a dystrophy as an autoimmune disease, and then they might give unnecessary immunosuppression also. So there
Yeah,
are so many, even
even
in
I
degenerative diseases.
had seen some patients with myofascial pain, simple myofascial pain, being treated as radiculopathy, underwent discectomy. So, so this all actually needs your clinical treatment. I had seen one patient who had PSP, being treated as cervical myelopathy, and he underwent discectomy also. So these things happens because they are not seen by neurology. Because neurology is one area you any difficult thing you send to neurologist, they will sort it out. That is actually the thing which is happening right now. Most difficult symptoms they send to neurology OPD.
Very true, sir.
Because I was asking you because you have exposure with JIPMAR, which is another one institute with just a lot of cases, and the consultants they are also very very good. I know a few of them. They were actually really good. So,
Yes.
I'm very happy that you were messaging me at that day after the this one, like your interview. Also, you talked to me, and you were telling about your wife was there. So
Yeah.
actually, and you being a Malayali, also that is also there. So uh, so I was so happy
Yeah.
to know that you when you called me, and I was in my OPD actually. So
Yes.
so happy at that time. So thank you very much. And
Thank you, sir.
and do you have anything to tell to those who are preparing for April INA, as well as those preparing for next coming SS,
Yes,
NEET
sir.
SS?
Yes. Uh, Honestly, for those who are preparing for I would like to tell them to not skip general medicine. As much as we will be diving deep into neurology and it will look interesting, and reading general medicine always will make you uncomfortable because so many topics are there to cover, and you will never have an idea how to cover these things. One tip I can tell them is Marrow has these custom modules. So why every day some 10 questions you go and make a custom module of all the subjects and solve them. So maybe you'll make 6 questions right and 4 questions may be wrong. So those questions itself you can go back and revise. That if you start reading from today itself, like you have 6 months, if you do a custom module of 10 questions itself, by 6 months you would be covering 360 questions. That will be a lot, and that day you will be more confident before exam that some general medicine you have covered. Because I feel like general medicine, if it's 20-25 questions, the weightage is as much as so I as much neurology, I beyond doubt it's follow what Vaishak sir is saying, nothing more. But at the same time, general medicine I would request not to skip.
Thank you so much, and uh, keep in touch. I'll be messaging you, and we'll meet up in some, like, I'll be coming around for some CMAs. We'll meet up
Oh, sir. It will be an
and
honor.
enjoy your days in neurology. Neurology is something which you cannot study with stress. You have to study with love and passion.
Yeah, sure.
So, all the best. Keep in touch.
Thank you very much. Thank you, sir.